At a hygiene appointment, I tell my patients there are like 3 stages. So you've got the cleaning stage, which is removing the plaque, removing the build-up. That's where we use a high-pitched ultrasonic instrument, so it can be quite noisy. Second phase is the polishing, so just removing the staining. We've got 2 different options for that. We've got the regular type of polishing, which is like a bristle brush and paste. The second type is called Prophy or airflow, where we basically jet wash the stains and it makes your teeth look a lot brighter, a lot whiter. And the last stage is the oral hygiene stage, where we tailor some advice specifically for you and your needs to help keep your teeth and your gums healthy. So it really depends on the patient's needs or concerns. So usually we say as a standard, if there's no gum disease or no gum issues, 6 months is good, twice a year. If there is gum disease, we do advise patients to come a little bit sooner, so every 3 months. This way we can monitor your gum health, provide deeper cleaning, and also just check up on you. Make sure everything's looking good, yeah. So it really depends on the patient's needs. We offer standard 30-minute sessions, but sometimes you may need a little bit longer if we need to do a little bit more deeper cleaning. Again, it depends. Obviously, pain tolerance is a thing. I try to be as gentle as possible, but sometimes if there is inflammation, if there is gum disease, your gums are likely to be more sensitive. But there are things we can offer to help with the pain. So we can always numb the area. We can provide some gel as well that can help the soft tissue feel a little bit less sensitive. Okay, so the benefits of regular hygiene sessions are we can always keep the gums nice and healthy. We can monitor as well if there is any gum disease or gum issues. So the difference between a regular clean and a deep clean is a regular clean sort of addresses your heavy buildup that you can see in the mirror. We remove the staining as well. However, a deeper clean is sometimes necessary if you do have gum disease. Also, if you do have quite heavy tartar deposits that might require a little bit more attention. Oh, okay, biggest mistake for those that use a manual toothbrush, heavy brushing. So sometimes you think you're doing a good job by brushing really hard and reaching those back teeth, but sometimes you can actually cause a bit of abrasion where your gum recedes slightly, and also you might notice a little groove on your tooth too, so be careful. Oh, smoking. Okay, but then for non-smokers, tea and coffee and soy sauce. So some patients are really good at using their manual toothbrush. They're very gentle and they remove all the plaque deposits, but a lot of us do tend to phase out while we're brushing. So I feel like an electric is a lot more effective because it does a lot of the work for you. You just have to hold it in the right position and it will do the job. Gum disease is caused by plaque buildup that accumulates along the gum line. It damages your soft tissue, so it damages your gum tissue, hence gum disease, but it also damages the bone that supports the tooth as well, which is why we need deeper cleaning. So tooth decay is caused by bacteria that sits in your tooth. If you feed it the right things, so sugary snacks, Tang-Fastics, toffees, then they basically eat away at your tooth surface and can cause you pain long term, which is why you need to get fillings sorted a little bit sooner.